Well, one business that knows a fair bit about political pressure is the nation's biggest private hospital operator, Ramsey Healthcare. Competition concerns have forced it to look offshore to maintain its robust growth of the past decade. And its next battlefront may be the means testing of private health insurance, a policy supported by both Labor and the Greens. I spoke to Ramsey's chief, Chris Rex, about the challenges he faces in a business that's highly sensitive to politics. Well, Chris Rex, obviously you're focused on overseas expansion at the moment, but is it fair to say that part of the reason for that is you can't really expand in Australia anymore because you wouldn't be allowed to take over HealthScope, and greenfields expansions are risky, and all of your existing hospitals are pretty well landlocked? Is that a fair characterisation of where you're at?
Well, some of it is, Alan, yes. It's certainly the motivation, I suppose, for us going overseas was the approach the ACCC took when we acquired Affinity in 2005. It was made clear to us that further expansion by acquisition in Australia was likely to be significantly curtailed. So we had a decision to take as a board. Do we stay in Australia and diversify into other parts of the healthcare economy?
Like pathology or something?
Pathology or diagnostics, or do we follow hospitals, and stay with hospitals, I should say, and follow that into other markets around the world? And it was the latter decision that we took.
You seem to have hit competition problems in the UK now. There was a complaint the other day to the Office of Fair Trading there about the lack of competition in private hospitals. Now, whether or not that gets up or results in any action, it does indicate, doesn't it, that really you're not going to be able to take over Spire Healthcare or one of the others to make further acquisitions in the UK.
Yeah, Alan, the competition complaint in the UK was more about price fixing rather than market share. I mean, at the moment we've got a quite small market share in the UK. We're only 10% of the overall private hospital system.
But there's not that many private hospitals, large-ish, even with 10%. There's not many of them.
No, that's correct. I mean, there are 5 major groups, including ourselves in the UK, and a relatively small number of individual facilities. But the issue that's been brought up is whether or not there's been any collusion on pricing, which there hasn't. I think that will be evidenced as the case.
Is that why you're going for France, because it's more fragmented there?
Well, the attraction of France, I mean, if you like, the push factor from the UK, where we're very happy, it's a market we now really understand and enjoy and have been successful in. But the other operators have got a very tight hold on their facilities. There is no churn at this point in time. So one of our key growth strategies is by acquisition. So, we started to review a whole series of alternative markets, and throughout that process, or the end of that process, France really came out as being a country where we thought that we could do well. One of the things was, of course, that it was, due to the fragmented nature of the market, a market where we could grow, incrementally rather than just buy something and be stuck for a number of years without further acquisition opportunities.
And is the high Australian dollar working in your favour and bringing the sort of per-bed cost of acquiring hospitals in Europe down?
Certainly from an acquisition point of view, the high Australian dollar is beneficial. Where it's not beneficial, obviously, of course, is the translation of earnings back from these countries into our consolidated results.
In Australia, there's talk of means testing private health insurance. Are you concerned that that'll result in lower usage of private health insurance? Currently it's 44.7%. I think it's been stable at that for a while.
That's right.
What do you think will happen to that in the future?
Well, we as a Private Hospitals Association, and also personally from a Ramsey point of view, we're obviously opposed to anything that a government does that makes it less attractive for people to contribute towards their health costs. I think any government looking into the future must see that with ageing and expanding populations, with greater expectations in terms of what healthcare will deliver to people, the government's role in funding and potentially providing healthcare, I think, will diminish as a percentage of the overall space, not just in Australia but in all countries. From a practical point of view, it's hard to assess the effect on membership. I mean, what was put forward in the last Parliament was pretty clunky in terms of the complexity that was involved, and cut in really at quite a modest level in terms of incomes. So I think whatever happens, that needs to be rethought through. But I think just from a principle point of view, it's just sending the wrong message.
So where do you think the riskier growth is, in France and the UK or in Australia?
Well, I think
or is there no? Is it all no risk? No, I don't think so.
There's never a business that doesn't have risk, but in essence, if you look at what's underpinning the growth for all healthcare providers in most countries, if not all countries around the world, with an aging population just spins off ever-increasing demand for healthcare. Australia in particular, but UK and France to a degree, have also got expanding populations. And as I said before, the generational change in terms of the nature of people who use healthcare services is moving from, if you like, a forgiving generation to a baby boomer generation who will create increased expectations themselves. So, there aren't too many worries, I think, in the sector about, is there going to be any work, going forward for the next 20 or 30 years. But clearly, the issues that surround that, well, how's that going to be funded? Healthcare is only a heartbeat away from, politics and government, so there are always some risks surrounding that. But really, I don't think there are too many micro risks prevalent in our business right now. Our biggest risk area will always be, governments and the approach that they take to healthcare, and that's something
it's interesting.
Lived with.
I mean, Ramsey Healthcare has grown tenfold in the past 10 or 12 years. Can it keep growing at that rate? I mean, in 10 years' time, can it be another 10 times as large?
With organic growth, with the capacity expansion that we'll continue to fund throughout the years, and with further acquisitions, I don't see that growth of that magnitude should be out of the picture. We want to continue to grow as a global provider. And it's quite conceivable over that time that we will enter new markets, as well as growing in the ones that we're already
Which ones?
Already in.
Any others? Do you want to mention?
Yeah, I mean, there are, well, not specifically, Alan, but I mean, there are some other markets in Western Europe that we're interested in. There are some developing markets where, if we're able to find the right vehicle to get in, we're quite interested in. And at some point, although I don't see it necessarily happening within the short term, the North American market, if we truly have aspirations to be a global provider at some point, we'll need to make an entree into the North American market as well.
Thanks for joining us, Chris Rex.
Pleasure, Alan. Thank you.